Assalamu alaikum, my dear esteemed fellow delegates. Thank you for this opportunity to introduce myself and the work that I do. I feel truly blessed and honored to address you today. We as medical doctors and allied health professionals are familiar with the Cartesian, I forgot to change my slides, excuse me, we're familiar with the Cartesian Newtonian model in our medical allopathic approach. If something is not working in the body, we fix it with surgery, prosthesis, or medication. This affects the physical level. The Cartesian model dissects down the management into and by virtue of its respective fields. Allopathic medicine is a system of healthcare that is supported by evidence-based scientific research, data collection, and drug testing. The biggest benefit that you will find is that this approach to medicine affords doctors access to the latest technologies to diagnose and treat diseases and physical damages to the body. For treating medical emergencies, the best approach is and always will be the allopathic system. Combining the best of allopathic and energy medicine is what my practice is all about. I'm inviting you to join me in exploring the dynamic systems theory, quantum physics, and the holographic model, which are employed by energy medicine to promote holistic healing in an integrated way. This is affected on all levels: body, mind, and spirit. This automatic, self-guided healing process initiated via the use of energy medicine's procedures and protocols are part of the body's inborn intelligence, or the innate wisdom of the body. The innate wisdom guides the overall functioning of the body-mind system, synchronizes all of the activities, as well as maintains the interface between left and right brain to collect information about breakdowns in communication within the patient's body-mind complex. We then rely on the innate wisdom of the patient's own body to facilitate the healing changes induced. In the dynamic systems theory, all of the systems work together to make the whole. No system is seen separately or experienced independently. Every single atom, cell, organ, tissue is seen to be in constant communication with every other atom, cell, organ, tissue, and system within the body-mind complex at all times. Everything functions according to dynamic interaction with everything else. In the dynamic systems model, the body is viewed not as independent parts, but as systems that interact with each other and are dependent on each other for their own functioning. Then there's quantum physics and the holographic model, which postulates that when the smallest particles of matter are broken down, there exists only vast amounts of space filled with possibilities and probabilities, suggesting that particles are merely concepts. The body-mind is therefore an interrelated web of concepts. One of the most startling conclusions that quantum physics has come up with is that consciousness is required to collapse all waves of possibilities and probabilities that exist into one form. That is, consciousness creates reality. Universal consciousness is the ground substance for all reality. Ibn Sina said, "The power of thoughts can either cause you illness or recovery." Stress is a profound effect on the body and its ability to function at an optimal level. Our bodies are designed to handle at least 10 continuous days of stress in a row. At day 11, if the patient does not have an outlet or find some form of relief, then all systems start breaking down. When a patient experiences ongoing stress, it can overload the energetic system of the body, all the energetic circuits, and these become compromised. This is similar to plugging too many appliances into an outlet and tripping a circuit breaker. A fuse has been blown and it needs to be reset. If it is not reset, then this sets the scene or landscape for degeneration, illness, pain, and other symptoms and pathologies to harvest. So if we look at the diagram, just want to draw your attention to that. That is exactly what an ideal, optimally functioning energy field actually looks like. A very healthy, whole, fully functioning person at their peak would look like that on the unseen plane. This is the ultimate goal in energy medicine. Energy medicine is designed to reestablish the circuits, the energetic circuits, and establish efficient, quick communication in an effective way, which then allows the body to very quickly recover and catch up in the healing process. In order to get to the state of perfect health and well-being and the perfect optimum energy field, like you saw in the previous slide, all the negativity that has accumulated to disrupt the energy field and the circuits of energy need to be removed from their point of destruction or disruption. Regardless of what level it is presenting at, whether it's cellular, organ systems, or on a consciousness level, or subconsciously, mentally, emotionally, or spiritually, once what does not belong there is removed, the area in question is repaired, and then we reach the goals we've outlined. Localized consciousness is what animates all reactions of the body-mind complex, right down to the cellular level. Its operation is obvious on a day-to-day basis by the homeostatic processes of the body that keep everything within optimal levels for all cells to function at their peak. Just as the body heals a wound with the particular sequence of biochemical, physical, and energetic responses, the body addresses all healing in a certain order. By the same token that we see all wounds heal through the same sequence comprising of hemostasis, inflammatory, proliferative, and remodeling, there is a sequence in which we heal all diseases, issues, and problems, and we need to respect the sequence of healing. I think it was Dr. Deepak Chopra who once said, the same energy that it takes to heal a cut is the same energy required to cure cancer. Now I'd like to introduce you to the energetic system. In the same way that the human body has the neurovascular bundles and channels, comprising of the veins, arteries, and nerves, the energetic system has two energetic highways which comprise of the chakras and the meridians. These cannot be seen when doing anatomical dissections or surgical interventions, as by definition, they exist on the unseen plane. So they can therefore not be seen by normal visual pathways involving our physical senses, but they can via the use of our subtle senses. The chakras are the body's generator system. It's like a vortex of spinning energy. There are over 300 of these energy centers in the body. It is through the cerebrospinal system that the body receives its life force that's coming from the energetic system. The meridians are significant in that every organ has its own meridian, which supplies that organ with energy. A blockage in the meridian would register and lead to a pathology in that organ. So depending on where specifically the blockage resides along the course, a variety of symptoms and signs would surface. We can imagine them as long extension cords plugging different parts of the body-mind system together. This system is said to transmit information related to every process in the body and mind. The 7 major chakras are high-frequency energy centers situated in close proximity to the cerebrospinal system. So as centers of transformation, the chakras step down subtle energies and transform them into nerve, cellular, and hormonal energy within the physical body. These conduits, or subtle pathways which facilitate this interchange between subtle and physical energy, are called nadis. The chakras are seats of consciousness through which we express ourselves. Different denominations call it different names, but essentially it's just a play upon words. The Hindus have coined it chakras. From the Islamic tradition, I have come across in the Quran a reference to at least 12 centers. And these are called, in the Quran, spiritual centers. I would like to draw your attention to the picture. Okay, this one. So each chakra not only services a different area of life or dimension, the way you see it positioned, but it also services an area of the body-mind complex that it is located in. So the base chakra, one right at the bottom, vibrates at a frequency of the color red and controls our one-to-many relationships. So for instance, me and all of you, me and everyone in my extended family, or you and everybody in the whole world, for instance. The sacral chakra, which is also called the second chakra, so it's the orange one, it vibrates at the frequency of the color orange, and it controls our one-to-one relationships in our lives. Okay? So moving on to the third chakra, which we call the solar plexus chakra, which vibrates at the frequency of the color yellow and controls our relationship with ourselves. So all our self-esteem issues are sitting here. Then in the chest, we have the fourth or heart chakra, which vibrates at the frequency of the color green. This one controls our ability to give and receive love, and it's also considered headquarters. Whatever's sitting here either motivates us and we're very driven, or very demotivated. So if anyone is wondering what controls your finances and determines your bank balance, does anybody want to guess? Any takers? No? Okay, so it's the orange and the green ones. What's sitting here will reflect and influence what's sitting in your bank account. So moving up to the throat chakra, it's the fifth one, which vibrates at the frequency of the color blue. This one controls our willpower and self-expression. So if you have a situation in your life where you feel like you're not being heard, as mothers sometimes we feel that way, then you're presenting with issues in this chakra. And it's possible to create something which we call high voltage willpower using this one. So it's quite nice in that regard. This one controls our self-expression. So the sixth chakra is between the brow and is also called the third eye. You might be familiar with that concept. This one vibrates at the frequency of the color purple and controls our intuition and spirituality. So then the seventh chakra, which is in the crown, vibrates at the frequency of the color violet. This one connects us to the divine, a direct link to Almighty Allah. Then there's the eighth chakra. It's not depicted in there. The eighth chakra is sitting above the body. And this is where everything we have inherited resides. So at some point, these trickle down the levels, and then they manifest into physical reality. But if we can wipe it out and clear the slate at this level, then there's no need for it to manifest on cellular level. Top-down causation of reality postulates that the creative energies can move from the conceptual to the manifested through 5 different levels of body. So that's the vital, supramental, mental, physical, and bliss. Corrections in the vital body will have visible effects in the physical body, since energy moves from the vital body to the physical body. So modalities like acupuncture and homeopathy will have very good results in the vital body because they are based on subtle energies. The supramental body is directed by the intuitive, higher aspect of consciousness. So modalities that use tools that can access this level of body will be working with the big picture, and then the effects will flow down to all the other 3 levels. Body talk practitioners work at this level, especially when they are non-attached and they have no agenda. Majority of the work that I do in my energy medicine practice involves working at this level. Body talk is a state-of-art approach to integrate mind-body medicine by combining allopathic medicine scientifically supported, forgot to change the slide, So body talk is a state-of-art approach to integrate mind-body medicine by combining allopathic medicine scientifically supported research in fields such as neuroscience, epigenetics, and psychoneuroimmunology, along with a large number of highly recognized ancient and modern healing methods and principles of knowledge. The theory postulates that everything that is problematic with the body is reflected in the brain as faulty activity. The mental body consists of the egoic mind and belief systems, attitudes, thoughts, and emotions. Jungian psychotherapy will make shifts in the vital and the physical levels. The bliss body is where spontaneous healing occurs, just like that. And there is no need for any modalities. Patient is operating from a fully enlightened consciousness. The healing that occurs from this level is instantaneous. It's what miracles are made of. Oh, sorry. Once the energetic formulas are established, the changes are facilitated via tapping them out on the head, the sternum, and the abdomen in a sequence. So this tapping activates the brain centers in a way that causes the brain to reevaluate the body-mind state of health and then align the frequencies within the body-mind to match the formula that was created. By tapping on the head, we are involving the brain in the repair process, and we are fixing the breaks in communication, in the communication circuits. By tapping on the sternum, we are saving the corrected energy circuit in the heart center, and in this way, sharing this information with every single cell in the body. The heart is responsible for communicating the state of the body's health to the rest of the body through the heartbeat and the cardiovascular system. This means that the patient's body will remember these changes after the session. Just like hitting the save button on a document will save changes to the computer's hard drive. In the same way, the patient can access them later. Lastly, we tap on the umbilicus to simulate the digesting and assimilating function of the gut brain, which is also called the enteric nervous system. So after the head brain has activated the changes from the formula and the heart brain has stored them, the changes need to be fully taken in and absorbed or digested by the gut. By tapping the navel, the changes become integrated at a gut level and become more fully embodied. As the patient's body stores the changes made by the brain during the tapping process, this means that every formula or circuit that is corrected builds on the one before. The patient's body actually remembers the session it receives, and the healing process continues and follows in sequence with each additional session administered. In this way, all repairs and changes induced in each case study. You're kidding, 10 minutes left, okay. That I'm about to elucidate, so I'm going to just run through the case studies. But before I do that, I just want to teach you one energetic formula, right? One procedure that will add value to each of you and your patients. So doing this one technique raises the consciousness of the entire planet. I'm going to talk very fast, right? And I'm going to demonstrate very fast. So that if we do this, the whole planet benefits. So I'd like you to join me in adding value to the field and altering it right now, okay? So I'm just going to stand here so you can see. So we want to establish deep abdominal breaths, right? So when you inhale and contract when you exhale. I'm just going to demonstrate it very quickly. So you're going to say, fix it, fix it, fix it, when we tap on the head. Store it, store it, store it. Fix it, fix it, fix it. Store it, store it, store it. Fix it, fix it, fix it. So we're going to continue. I'm just going to speed this up. You don't want to join me? Nobody's joining me. I'm doing it alone. Okay, it's okay, sir. It's fine, it's fine. Fix it, fix it. Breathe, please. Breathe, breathe. Fix it, fix it, fix it. Store it, store it, store it. Fix it, fix it, fix it. We're speeding. Fast forward, fix it, fix it, store it, store it, store it, fix it, fix it, fix it, store it, store it, store it, fix it, fix it, fix it, store it, store it, store it, fix it, fix it, fix it, store it, store it, store it, fix it, fix it, fix it, store it, store it, store it, fix it, fix it, fix it, store it, store it, store it, fix it, fix it, store it. So when you're doing this part, you are establishing a magnetic field, okay? So you're going to pause for a few seconds and then fix it, fix it, fix it, store it, store it, store it, fix it. I did it very fast, okay, because of no time. But spend 2 full deep breaths for each hand position. I'm happy to email it to everybody so you have a video of this, because I didn't do a very good job here because in the interest of time. So now, I just got, whoever did do the tap outs, I got you to just reboot your brain, okay? Now a warning, there are side effects, okay? This gets rid of, okay, brain fog, headaches, it improves mood, concentration, focus, attention. So all of you who didn't do it, I'm so sorry you missed out. We're going to move on very quickly to the case studies. Okay, so I'm going to very fast, very rapidly go through this. 47-year-old male patient presenting with severe lower back and left leg pain. He's a known hypertensive. He walked in hunchback, complaining of unrelenting pain. So the next slide, I think just read it yourselves, because I don't have time to do that. I would have, but... Okay, so to cut a long story short, just read the story. He was booked for a decompression infusion procedure, okay? 2 sessions later, he walked out completely straight with good posture, completely straight and pain-free. His surgical procedure was canceled as it was no longer necessary. I'd love to say that every patient responds so rapidly, as this one, but unfortunately, each patient is unique, and so are their healing journeys. So not everybody's journey is this rapid. Okay, so the next case was a cerebral palsy patient that made his first appearance at age 4. He could not walk, so his mobility entailed shuffling his bum on the floor to move around. It took about 8 sessions before he started walking in a normal manner. I never saw him again. I'm sorry. Did I do something wrong? Sorry, okay, but you got the story. Case 3 and 4, 2 patients, both with similar profiles, presenting with multiple miscarriages and a desire to fall pregnant and maintain pregnancy till delivery. The 35-year-old patient required 2 sessions, the 29, 3, before they fell pregnant and delivered normal, healthy babies. Sorry, I'm just going to speed read. 15-year-old female patient presented with polycystic ovarian syndrome, acne, and insulin resistance. So after a year of regular sessions every 8 weeks, all the above presenting issues resolved, subsequent scans were completely normal. A 45-year-old female patient presenting with depression, insomnia, and abnormally high prolactin levels for a year and a half before seeing me. She was managed by her endocrinologist for 3 years before coming to my practice. After 1 session, where I tweaked her pituitary gland, she felt really good. Subsequent blood tests revealed a normal prolactin level of 9 nanograms per ml, and her insomnia resolved. She furthermore added that her menstrual irregularity also resolved, in addition to an unrelenting pain below her right scapula that she suffered with for several months. To quote her, "My whole right side under the blade was like in a twist, and nothing helped. But after the session, it just went away." A 48-year-old medical colleague presented with pulmonary hypertension, tachycardia, and chest pain. The loud P2 was audible without a stethoscope, so grade 5-6. After his session was completed, I advised him to wait at least a week prior to redoing his ECG and investigations to give his cells time to change. But he didn't listen. He repeated it 3 days later, but the results were still astounding. Not only was the ECG completely normal, but all symptoms and signs had disappeared, and all investigations were normal. We copy and replicate what we've been exposed to. Wrong slide. Yeah, there we go. No. Yeah. We copy and replicate what we've been exposed to. This phenomenon was so clearly demonstrated in a patient presenting with ITP. So we're introducing here an 11-year-old boy who was diagnosed with ITP at 8 months of age. He's a current patient who has had 3 sessions with me thus far, wherein I retrained his immune system to make adjustments in the job description of his macrophages. So prior to the session, the macrophages, which are equivalent to the garbage truck of the immune system, were recognizing his platelets as foreign invaders or pathogens that warranted destruction and were thus far broken down and eaten up with them. I had to re-educate the macrophages to ignore the platelets and leave them alone. Sorry, gonna have to. This re-education entailed settling them up to specifically prevent attachment to the GP2A receptors on the platelet surfaces, so destruction of the platelets does not take place. In addition, I had to work on his spleen to get to them to stop production of IgG autoantibodies to bind to the surface proteins found on platelet surfaces. I was pleasantly surprised. Okay. I'm just going to let you read that yourselves, and then I'll tell you what I need to tell you about it. I was pleasantly surprised at his next session when the penny dropped and I uncovered the underlying etiology that produced the ITP. He inherited all his mother's issues around her self-criticism that she was wrestling with when he was just 6 months of age. These were filtered down to him and were metabolized in his body-mind system and manifested as the autoimmune condition he presented with. There was a significant improvement in his blood results after the first session. His platelet count had risen significantly and his bruises reduced. His mother was very happy with his progress, as they as parents had been back and forth to doctors for the last decade to no avail. So you read this already. I'm going to just skip through it. So what I want to tell you about... So the part that you didn't see there is... Her mother came to see me, right? You all read that? So the first time she came to see me, she said, "What did you do to my daughter?" So I was like scared, and you know how we feel when we feel like somebody is accusing us of something. So she said, I was caught off guard, didn't know how to respond, so I didn't. She said, her daughter used to be very quiet. They could barely hear her speak, and when she did speak, it was very little, as she was very depressed, tearful, and withdrawn. All the time on account of the trauma she sustained. Now, she's the loudest, most assertive, talkative person in the family. No one can shut her up, and she has a thriving dental practice. Okay? I don't know if you read that she's also met and married. Yeah, you read that. So approximately a decade ago, there was a businessman. Okay, he contracted measles from a client. He developed into a pneumonia and subsequently septicemia, and finally was in a coma when my help was enlisted. So I did one session, and I had patients that day. I was in Johannesburg, he was in Pretoria, so I did it remotely. When I got to the hospital, his brothers told me that he had so much energy. He woke up as soon as I was done with the session, sat up, pulled off the endotracheal tube, and to cut a long story short, he spent a total of 18 days in hospital, and then he was gone. He recovered very nicely. So 2 months ago, I got a call from a new patient in England presenting with a chronic sciatica, which her doctors repeatedly diagnosed and treated her with using Celebrex. So this continued for a year, on and off. Finally, she wanted my help, so I uncovered, this was a remote session because she was in England, I uncovered an issue with the pudendal nerve, the superior part that's next to the, in close proximity to the sciatic nerve. So to cut a long story short, I found just issues with, you can read the rest of it, yeah? So I'm just going to go to the end of it. I uncovered those 4 blocked meridians, okay? And now her pain has disappeared and she's doing very well, has lots of energy. So all doctors have an extra energy field that is transmitted to all their patients in need. This is not something we can control. This is something that is controlled by Almighty Allah and is dispensed by Him, in case you didn't know that. To demonstrate this, I'm going to tell you one last story. About a decade ago, I had a patient that contacted me from Durban. She had a surgical wound that refused to close and heal. So before I worked on her, remotely of course, she went through several weeks of antibiotics on account of the infection that kept recurring. So in this session, what I discovered, sitting at the suture site, was the surgeon's belief and thought, and I quote, okay, "This is not going to work." So unlikely he was referring to his expertise in closing up the sutures and completing his surgical procedure. What I got a sense of was whilst he was conducting her surgery, he was thinking about something in his life that was not going to work. At the same time, he was performing her surgery. So these thoughts, feelings, and beliefs leaked into her and followed in their job description, with making certain her sutures did not work. As soon as I removed that and repaired the area in question, the wound closed and she healed beautifully. She never needed further assistance and no more antibiotics, topical or oral. So in the interest of time, I'm going to very briefly go through, and I'm almost done, some more success stories of what I've been able to achieve thus far rheumatoid arthritis, Sjogren's syndrome. 3 sessions later, we could kiss that goodbye. I've had success treating depression, anxiety, allergies, post-traumatic stress disorder, ADHD, headaches, learning difficulties, substance abuse, weight loss, constipation, gastritis, COVID, long COVID, and I'm not going to tell you the rest. So we are 99% spiritual and 1% physical. So when we make the paradigm shift to experience ourselves from this higher place of consciousness or higher perspective and place of reference, science teaches us that seeing is believing, but Islam teaches us that we need to believe before we get to see. Our Quran teaches us this, and I'm sure it's in every tradition. So a paradigm shift is of paramount importance in order to get the best results. Those waves of possibilities and probabilities that are contained with every cell or atom that I mentioned in the beginning teach us that we have the potential in every given moment to produce a certain result. If we are positive and have good, pure intentions, then this will order the day. If we are negative, then that will order the day. We are feeding and leaking our energy, our thoughts, our words, and our deeds into everything we do. If we look at Einstein's equation, E is equals to mc squared, then what that teaches us is that energy and matter are exactly the same. They differ only in the frequency with which they vibrate. So matter vibrates at a frequency reduced to visibility, and we can experience it that way with our physical senses.
I'm going to have to ask you to stop.
Okay,
sorry.
all right.
I'm sorry. I see what about 7 pages still left, so I'm going to have to stop there because we're already about 7 minutes over time. So
Okay.
thank you very much, Suraiya.